Naltrexone basically will make it less likely for people to enjoy a drink, make it easier to sort of drink more slowly, make it easier to delay the first drink. And the goal is that it's really a tool for people to start meeting their goals of drinking less. But it also, of course, works best in combination with therapy, coaching, Alcoholics Anonymous, et cetera. So an interesting question is that naltrexone, when I'm explaining this to patients, they say, well, is that going to make it hard for me to enjoy other things? And I really can't tell you why it doesn't, but it doesn't seem to. Having said that, there'll be a really small subset of people on naltrexone who will experience depression from it and feel kind of numb to activities, to pleasurable things that they normally do. In that case, we usually look at an alternative medication because that's really untenable. But it's remarkable how uncommon it is. It's remarkable to me how often I prescribe naltrexone along with an antidepressant. So in other words, naltrexone doesn't seem to worsen depression. It seems to work pretty specifically for helping people drink less. It's really interesting that I find that SSRIs, so selective serotonergic reuptake inhibitors, commonly Prozac, Zoloft, Lexapro, their generic names are fluoxetine, sertraline, and escitalopram, they not uncommonly cause people to feel blunted in all their emotional responses. Now, if someone's depression includes a lot of irritability and anger and overreacting to everything, that's a good thing. Let's turn that down a little bit so you're not yelling at people or lashing out at people. And that is really where it works best. But if you find that you're blunting your pleasure and things that you should be enjoying, then that's a problem. And so sometimes people will use the language of, I just don't feel like myself. I feel blah about everything. And no, I'm not getting angry anymore, but I find that I'm just feeling not myself. And so that to me is an indication to stop the SSRI. That's not what we're looking for. We're not looking to change your personality and experience to that extent. I would say it probably is about 5% of people who take SSRIs, something like that, have this response. But what my point is that the SSRIs seem to cause it much more commonly than naltrexone does for whatever reason. So I'm familiar when people describe that sort of blunting or muted response, and that's not what we're looking for.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.